Okay, we're going to look at our last section, which is on joints or articulations. I'm going to briefly go through this. There's some things that we'll talk about and some that are more important than others, so I'll give you some keys here. A joint or an articulation is a junction between bones, so where bones meet. So your shoulder joint, your hip joint, your sutures are considered joints. So a joint is going to give body movement, it's going to bond things together, it allows changes during childbirth, like we talked about, how your pubis symphysis allows for your hips to change a little bit. Immovable joint is synarthrotic. Amphiarthrotic means a little bit movable, and diarthrotic are your freely movable joints, which are probably your most common. Also, we have fibrous, cartilaginous, and synovial. Fibrous joint, sutures of your skull are fibrous, and they are immovable, and that's the main one that I want you to know. So fibrous joints, sutures of your skull, they are immovable. And there's just a picture made up of connective tissue, and then that suture is what basically bonds one of your skull bones to another. Cartilaginous joints, hyaline and fibrocartilage are the main ones. Intervertebral discs help to absorb shock, protect one vertebrae from the next. The pubic symphysis, the one that is in your hip, would be another. And then there's cartilaginous joints between the first rib and your sternum. That one's not probably so important. Synovial joints. Most joints of the skeleton are synovial. I might ask a couple questions more about this. So a synovial joint is going to have free movement. Your knee. If anyone has ever had knee issues, shoulder issues, we have a football player right now that's having some joint issues. We're going to talk about the different parts of it, so it will maybe make a little bit more sense to you. The articular end at the epiphyseus of the bone is where a synovial joint is, and it's covered with hyaline cartilage. We talked about that when we talked about long bones. A joint capsule, if you ever injure a joint, you might hear this term. Joint capsule is the outer layer of the tissue. It joins the periosteum, and then it's going to help make up a synovial membrane. The synovial membrane secretes fluid, which is very important for your joints to keep them movable. It's kind of like it prevents friction. It has the consistency of egg whites, and it's very important, like I said, for lubrication and keeping things moving. So it's a thicker liquid. So if I'm looking at, let's say this is your knee joint. So here's my articular cartilage that covers the ends of both. Synovial membrane is going to surround all of the synovial fluid that's going to be found on the inside. And then the joint capsule is kind of the whole outside membrane that holds it together. So my fibrous capsule will probably consist of ligaments and tendons, and then my synovial membrane is the inner layer of that joint capsule. Some synovial joints contain shock-absorbing pads of cartilage called menisci. A torn meniscus is what this would be. Your meniscus is a little pad that basically protects your femur from your tibia so they don't rub together. If you've done something to damage a meniscus, your bones can possibly rub together, and that's painful. Or as people get older, those pads will start to shrink so they're not so big, and that can also produce pain. A lot of your synovial joints also have little fluid-filled sacs, so it has the synovial fluid in other little areas, and those smaller sacs of fluid are called bursa. If you've heard of bursitis, it's a common joint issue, and those bursa help to aid movement of tendons. There again gives some lubrication, so it's easy for things to slide around. So looking at a knee joint, here's your patella. It's held in place by these tendons. There is some fat for protection also. Here's my articular cartilage again, and then your meniscus sits right in this area in between your two bones. Notice I have different bursa, and I will not ask for specific ones, but a prepatellar bursa is a small sac of fluid that protects the front of the knee. Infrapatellar bursa, these are small little packets of fluid used for protection. Types of joints. Ball and socket produces the most amount of movement. That's going to be an example of like your shoulder and hip. Basically, you have a head of a bone that's going to fit into another cavity. So in your hip bone, the head of your femur fits into your acetabulum. The head of your humerus fits into your glenoid cavity. Lots of motion, round, moving, back and forward, all sorts of motion. Condylar joint, I probably won't ask about. Ball and socket, the most common, the one you should know the most. A condylar joint is going to have a condyle. An example would be in your hands, a metacarpal and a phalange. Gliding joints have a little bit of a curve. They're going to pivot back and forth. Examples there are your wrist and ankle, some between your vertebrae. So not as wide of movement as your ball and socket, but a fair amount of movement in your gliding joints. Hinge joint, it basically forward and backwards is the only direction it goes, and that would be like at your elbow. I can't rotate without turning my entire arm, so a hinge joint just simply goes back and forth like a hinge on a door. Pivot joint, there's only a couple of those. It's going to rotate around a ring. Your axis and atlas would be examples of that. And saddle joint, the only one that you have is your thumb. There again, probably not going to ask specific questions about where those are located. A few terms, these you should know. Flex means to lessen the angle, so I'm decreasing the angle. Extend means to turn out or make a larger angle. Dorsiflexion is a lifting of, I'm not going to lift my foot up into here. So if this is my ankle, dorsiflexion is lifting it towards the shin. Plantar flexion would be more of pointing your toes. And there's pictures of these in your book. Hyperextension, if you've hyperextended a joint like your knee, you extend it beyond the normal position. Abduction and adduction. Add, you're adding it to your body. So adduction would be bringing a joint closer. So I'm adding this to my body. Abduction, away, I'm going to bring it away from the body. And then lateral flexion is bending something to the side. So if I bend my head to the side, that would be a lateral flexion. And these pictures are in your book. You can look at those. Pronation, palm down, facing the posterior, sup, and it's supination, but I call it sup because it reminds you that the palm is upward. So here you can see pronate means to bring the palm down. Supination brings it up. So those are two different ones. And that's probably about, look through these joint movements. I probably will not ask these on your test. And that's the end.